OK, we're joined now by Dr. Nick Maynard. He's a consultant surgeon who recently volunteered for an emergency medical mission in Gaza with the British charity Medical Aid for Palestinians. He joins me live from the United Nations headquarters. Thank you so much for your time on Al Jazeera. You've described your trip to Gaza back in January as the single worst experience in your 36 medical career. Can you tell us what you saw?
Yes, thank you for asking me. I've been going to Gaza for nearly 15 years, and I thought I would be I'd be prepared for what I was going to see when I went into Gaza on Boxing Day. But what I saw at al-Aqsa hospital was the single worst series of cases I've ever seen in my career as a doctor. Appalling clinical situations we found ourselves in, great lack of resources, but most of all, the most appalling injuries, predominantly on children and women, and I spent most of the 2 weeks operating on severe explosive injuries to the chest and the abdomen, and the majority of the patients I operated on were women, and I saw some severely injured children as well.
Yeah, can you expand on that? What was the hardest part of your experience when you look back?
I think seeing some of the appallingly injured children in particular. I spent some time in the emergency room at al-Aqsa hospital as well, and saw some very small children with terrible burns, multiple traumatic amputations, and no real room to deal with these tragic cases. The resources were very limited. On some days we had no morphine, no strong painkillers to give these patients, and I remember seeing one small child who had terrible burns to her face, so bad that you could see the bones of her face, and she clearly had no chance of survival and was going to die, but we had no pain relief to give her. So not only was she certainly going to die, but she couldn't die peacefully. She died in agony. There was nowhere peaceful for her to go. She ended up lying on the floor of the emergency department. And this was one case, but we saw multiple cases like that, and they were deeply, deeply tragic.
I believe you also started seeing some malnutrition cases back then.
Yeah, so this was back in sort of around the new year, and the paediatricians in al-Aqsa hospital were seeing 2 or 3 cases of kwashiorkor, which is the most severe form of protein malnutrition you see. And it sort of conjured up images of the famines we sometimes saw in Africa years ago, where these pot-bellied children with severe malnutrition, and that they were appearing at al-Aqsa hospital back over the new year. And on the surgical wards, we saw patients who were malnourished, and there are so many problems with infections in the hospitals there that virtually every patient who ends up having an injury and having surgery gets a bad infection. And of course, when you've got severe infections, it accelerates the process of malnutrition. So we ended up seeing some patients severely malnourished. And of course, we've heard in the last few days about the man-made famine, shall we call it, that's now existing in Gaza, and that the malnutrition problems are getting ever worse. And you have this terrible cycle of sepsis, infection, malnutrition, and they exacerbate each other. So this is a profoundly severe healthcare problem, and I think the numbers of patients we're going to see from these excess deaths due to malnutrition will dwarf the figures currently being quoted for deaths from the trauma of about 30,000. I think we greatly fear those figures are going to be well in excess of 100,000.
And as you were saying, you have been visiting Gaza for many years to teach surgery since 2010, I believe. What did you make of the state of the medical facilities in this latest visit? I mean, they're incredibly challenging. I think even working in the healthcare section in Gaza in quieter times, pre-October the 7th, were very challenging. So we always have to deal with lack of resources, often electricity cuts, and having to make do with very limited equipment. But those challenges have been dwarfed by what we're seeing now. I spent every day operating out there. We often ran out of surgical gloves, so you had to sometimes wash gloves between operations. I've mentioned already the
lack of morphine. We had many days when there was no pain relief to give to patients, often no antibiotics. The surgical instruments we were using were very lacking, so we had to make do with not so much the wrong instruments, but very different instruments. There were sometimes no blood products. On one day we had no running water in the operating theatres, so we couldn't scrub up properly. We had to use alcohol gel to try and clean our hands. We sometimes had no sterile dressings. We had no sterile drapes for the patient in the operating theatre, so extremely challenging circumstances. And of course, for the post-operative care, they went to wards which were appallingly overcrowded. Often there were no beds to put the patients in, so they were lying on the floor. The health information system had completely collapsed, so it was extremely difficult finding patients on the ward to see how they were the next day. So many patients were not being followed up properly. So the challenges were worse than I could possibly have imagined.
And Doctor, the Israeli narrative when it comes to targeting hospitals is that they are targeting Hamas operatives who are hiding inside these hospitals. Given what you've seen, do you think the damage and the violence on the people of Gaza in those hospitals is justified?
Not at all. And of course, this is the narrative being peddled by the Israelis. I've been going to Gaza for many years, as you mentioned. I have never seen any Hamas militants in any hospital I've worked in. I know Shifa Hospital extremely well. I've never seen any Hamas militants there. More importantly, during my 2-week stay at al-Aqsa Hospital, I had access to every single part of the hospital. I visited every part of the hospital regularly and have seen no Hamas militants at all. So, and of course, the Israeli Defence Force have provided no credible evidence to support those claims. Perhaps as a final thing to say about this, I have many friends and colleagues who are doctors and nurses in Gaza, and I've known them for many, many years. I've worked with them. They've been in these hospitals day in, day out since October the 7th. I've been talking to them regularly, and quite apart from my own experiences in al-Aqsa, they all report never having seen any Hamas militants in any of these hospitals. Now, of course, I can't comment about what might be happening in any tunnels underneath, but certainly I have seen no evidence of any Hamas military in the hospitals. And as I said, I think the evidence being put forward by the Israelis to support those claims is not remotely credible.
Dr. Nick Maynard, consultant surgeon who has recently volunteered in Gaza. Many thanks for your time.
Thank you very much indeed.